Our study specifically looked at the incidence and rate of Clostridium difficile infection in patients undergoing radical cystectomy for bladder cancer. Our primary hypothesis was the rate of C. diff infection was much higher in patients who got neoadjuvant chemotherapy compared to those who did not get neoadjuvant chemotherapy, because we thought getting the neoadjuvant chemotherapy would somehow put them at increased risk. So when we compared our retrospective series of patients, we had about 140 patients or so over the last 3 years that we'd done radical cystectomies on. Half of them had received neoadjuvant, half of them had not received neoadjuvant. And what we found was there was a difference. Those who had received neoadjuvant chemotherapy, the rate of C. diff infection was about 12%. Those who did not receive, the rate was about 8%. But the difference was not big enough to be statistically significant. That being said, the trend was towards significance. So if we have a larger sample size, we may show a difference. Overall, though, what was concerning is that if you look at the population-based rate of C. diff infection, which is about 156 per 100,000, our rate was 136 per 1,000. So it's almost tenfold higher in the cystectomy population. So that itself suggests that something is going on that significantly increases the risk of C. diff infections in these patients. And overall, for the United States, as notified by the CDC, C. diff infection today is considered a major, actually the most common nosocomial infection in hospitals. So this is an important area for us to tackle. We looked at different antibiotic usage, frequency of antibiotic use, PPI use, and tried to control for all of these factors. None of them seem to really be associated with increased risk of infection. So we have to figure out what may be driving this and also how much chemotherapy is adding to the mix in terms of risk.